What if a COVID-19 vaccine is never developed? In 2020, the entire world stood witness to an extremely rare occurrence, a global pandemic. What started off as a flu-like illness in China has gone on to become one of the widest and fastest spreading diseases of current times. In this video, we're giving you our take on what if a COVID-19 vaccine is never developed. Welcome to Mind Talk, where all brains matter. If you're new to the channel, you're going to want to head on over and hit that subscribe button. If you're ready to have your mind blown, ring that notification bell as well so you'll never miss another video. The coronavirus outbreak has now affected over 24 million people and has taken the lives of about 800,000 people around the world. Currently, the only way for humans to protect themselves from the coronavirus is to practice strict social distancing, along with wearing masks and regularly sanitizing or washing their hands. But with thousands of people still testing positive and dying after contracting the disease, it's clearly not enough. Countries like Russia and the United States have been working to develop vaccines to cure COVID-19, but they might take years to perfect and put into effective use. What's more is that tons of doctors have admitted that there's a huge chance of them not working at all because of the unknown nature and mutation of this virus. The question to be asked then is, what will the world do if a vaccine for the deadly coronavirus is never developed? Looking at the rate at which this disease has taken over the world, many scientists have agreed that it's nearly impossible to make the coronavirus disappear completely. Coronavirus updates and research has shown that, like all viruses, COVID-19 might also have the ability to adapt and evolve, which means that its future strains might outlast any vaccines that we develop, especially in places like Europe and the US, where the virus has had the most amount of impact. It might take years for the disease to go away completely. Diseases like the common cold, the flu, and measles are examples that humans have never really been able to eradicate viruses, so there's a high chance we're all stuck with COVID-19 for a long time. With risks like these, in the case that no effective vaccine is developed, how will life go on? Will the entire world be in a state of self-isolation until the virus somehow goes away? Research at the University of Texas Medical Branch has shown that there might be another way to slow down the pandemic. From Coronavirus News, it's already an established fact that the spread of COVID-19 is extremely easy. Just like the common cold, it doesn't take much for people to transfer the virus amongst each other through sneezing, coughing, and physical contact. However, the virus is far more dangerous than any kind of cold or flu. While with the common cold, the antibodies produced in the human body induce an immunity that doesn't last long, scientists believe there's a chance that the immunity produced against COVID-19 lasts much longer. With vaccines still being in their development phases and the fact that not everyone will immediately be able to afford it if it does work, many countries are relying on the process of herd immunity to stop the spread of COVID-19. The idea of herd immunity isn't anything new. In the past, herd immunity has been used for a kind of immunity that arises within communities where a certain vaccine has been introduced among a small group of people who've been affected by some kind of disease. As long as the vaccination rates in a community remain high, the spread of any kind of contagious virus can be effectively slowed down and even stopped. And thus this herd of people is immune to certain diseases, even though everyone hasn't received its vaccine. Of course, you must be wondering how this will all work when a coronavirus vaccine hasn't even been invented yet. Well, you'd be surprised to know that research has shown a huge rise in what scientists have been calling natural herd immunity. While this is still a theory, doctors have put a lot of hope into it. In broad terms, the theory states that if enough people are affected with COVID-19 and they survive, they'll become immune to it and in turn induce immunity within communities by stopping the spread of the virus. While this does sound like the most logical step we can take at this point, it does come with its own drawbacks. If we simply let the virus run its course and affect a certain number of people before slowing down, we're basically just giving up and saying that these people have to die for a greater number of people to survive. While in the case of a vaccine, people who have lower chances of surviving COVID-19 would have an equal shot at regaining health. With that said, for the majority of the population, scientists and people may believe that herd immunity is a good idea because it means we won't have to keep waiting in isolation for a vaccine. However, several countries like the UK and Sweden, where infection rates have been high, have quickly abandoned the idea of herd immunity simply because it was resulting in the loss of too many lives. In Sweden specifically, because people were trying their best to socially isolate and avoid contracting the disease, the desired percentage, which is about 50 to 80% of people to be a part of the herd that gets infected and immune to the virus, couldn't be reached naturally. The U.S. has also given up on the idea of herd immunity simply because it would require too many resources to treat and bury the millions that would be affected in the process. After that, there's the question of possible reinfections that have been predicted to rise as we proceed towards the winter. Many scientists still do believe that it's possible for the virus to reach a benign state once our immunity systems have been conditioned into fighting it. That still doesn't guarantee its complete disappearance. While herd immunity sounds like the best option we have without a vaccine, its consequences are far too dangerous for it to be employed as a primary method of fighting the coronavirus. With so much at stake, the future without a vaccine definitely looks bleak. Although research centers all over the world are still dedicated to finding a cure for this seemingly uncurable disease, the most likely scenario is that we'll have to adjust to a world where living with COVID-19 is the new normal. Wearing masks and practicing social distancing, although tedious and inconvenient, seem to be the only way for the world to continue functioning without a vaccine. Even the World Health Organization has pointed towards the possibility that stomping out the virus might even take decades, making the coronavirus not just a pandemic, but also an endemic, a disease which has the potential to be constantly maintained within populations. In this case, testing and retesting people constantly is the key to making sure that the virus is contained as much as possible. There may be more period of lockdowns and self-quarantines to come. How we shop, play sports, work, and live may change forever. We'll find a way to adapt to this new norm of life. While the world economy may be in a recession for a long period, we'll find new ways to be innovative and prosper. With the daily number of deaths, hospitalizations, and confirmations of cases worldwide, the only way for us to deal with COVID-19 is to learn how to live with it while also staying safe. While we all yearn for a quick solution to rid ourselves of this deadly disease, it seems like the world will need to learn how to be patient, empathetic, and careful as we move on with our lives in the presence of a virus that currently has no cure and is showing absolutely no signs of slowing down. That's a wrap for What If a COVID-19 Vaccine is Never Developed? What do you think is going to happen if a vaccine is never developed for the infectious virus? Let us know in the comments below. Make sure to give this video a thumbs up and subscribe to our channel for more videos like this. We'll see you in the next one.